Well, COVID-19 and its lessons so far for us all has been a part of this week's proceedings at Virtual Wish 2020. And while no part of the world has been untouched, the responses have varied. To date, Mauritius has had fewer than 500 COVID cases and just 10 deaths in a country with a population of more than 1 million. It took strict action on border controls in the middle of March, with far-reaching consequences for an island nation where tourism is a big part of the economy. Our final keynote address explores that balancing act. It's from the Prime Minister of Mauritius, Pravind Jugnauth.
Your Highness, Sheikha Musa bint Nasser, Your Excellencies, Lords, Ladies and Gentlemen, good evening. It is an honor to address the World Innovation Summit for Health 2020. May I start by thanking the government of the State of Qatar, Her Highness Sheikha Musa bint Nasser, the chairperson of Qatar Foundation and founder of WISH, Professor the Lord Darzi, Her Excellency Mrs. Sultana Afdal, and the whole team at WISH for the kind invitation extended to me to address the closing ceremony. The COVID-19 pandemic has put the public health and economy of the world in turmoil, and thus the holding of a global health conference is timely, relevant, and opportune. WISH is a positive example to the world, showing that health transcends diplomatic or geopolitical concerns. In these historical times of great uncertainty, we must indeed come together to engage for a collective and coordinated response to the pandemic in a spirit of sharing and commitment so that we can best face the future. Mauritius faced the COVID-19 pandemic with some trepidation. Even though a small island isolated in the Indian Ocean, we are globally connected, hosting over 1.3 million tourists annually. Our 1.3 million citizens live mainly on a densely populated island, not much bigger than Greater London. To make matters more demanding, we have an aging population with, unfortunately, a high percentage of diabetes and cardiovascular morbidity. Considering our circumstances, our response has been heralded as one of the most efficient in the world, as we managed to contain, in a matter of 6 weeks, the virus which reached our shores on the 18th of March. We recorded a total of 491 cases, out of which 277 were imported. We have had only 1 case in the local community since April, and sadly, 10 fatalities, the last being in April. The fight against COVID-19 is a tough one and is still far from being won. That is why we remain fully engaged and on the alert. There were a few core tenets to our approach to the pandemic, which I believe contributed to the successful management of the pandemic locally. Our multi-layered response was based on scientific and medical data, with considerable advice from national and international experts, including those from the WHO. We, as government, took our responsibility and led. I continue to chair a high-level interministerial committee comprising key public servants, medical advisors, and experts, including the WHO representative, to ensure that the right decisions are taken based on the constant flow of information related to the virus. We have implemented strict protocols with regard to sanitary measures at entry points of our territory, with the preservation of public health and safety as the key drivers of our actions. We have a very strict policy of PCR testing, quarantine, isolation, and treatment, as well as contact tracing, as a central part of our containment strategies. In this regard, the positive response and overwhelming cooperation of our population greatly contributed to the curtailing of the propagation of the virus. The ability of Mauritius to handle the pandemic also rested on the depth of its public health infrastructure, built over decades, with at its core the provision of universal, accessible, and quality health services free of any cost. Furthermore, our national experience of fighting diseases since the outburst of malaria in mid-20th century has led to border management and contact tracing being hardwired into our public health administration. We later faced the chikungunya virus in 2005, and more recently, we have been managing localized instances of dengue. All of these experiences and the consequential long-term investments in public health have meant that our public health officials stood in alert and stayed mobilized. Preparedness at all required levels was indeed of high essence. Nevertheless, the handling of the pandemic of an unprecedented scope and magnitude remained a challenge. As the situation evolved, we had to not only review health protocols, but also to reorganize our hospitals, acquire relevant medication and equipment. In the midst of the pandemic and at the onset of the wintry season, our dedicated health services carried out door-to-door flu vaccination for the elderly to increase their immunity. All this has strengthened our indomitable will to place investment and preparedness in public health at the very heart of all governmental decisions. As you may have gathered, our approach to the pandemic has been very steadfast and firm, starting with a nationwide lockdown in the first few days of detecting a local COVID-positive patient. With due humility, we take pride that on the Oxford University Stringency Index, an index which tracked government policy and action with regard to COVID-19, Mauritius scored a perfect 100. We took difficult but right decisions. However, we also face the stark reality of the impacts of the pandemic on our economy, with the drying up of international visit numbers, both in terms of business and tourism. Our borders remain closed except for some scheduled flights. We still maintain a rigorous and mandatory 14-day quarantine, one of the strictest arrival sanitary protocols in the world, to ensure that our citizens and residents remain protected. To mitigate this inevitable slowdown, my government is providing, through a raft of measures, significant economic income and job support to affected sectors of the economy to ensure that our country transits these challenging times without structural collapse. And this support prepares the ground for rebuilding the economy on a sustainable basis. Ladies and gentlemen, the resurgence of cases in many parts of the world, including in developed countries, only confirms the soundness of our response strategy. And looking to the future, it seems clear to us that those nations with the most appropriate public health policy stand to benefit from stronger long-term economic recovery. As the centerpiece of our own recovery policy, my government is committed to injecting significant national resources which will total almost 30% of the country's GDP to support and build the economic recovery of Mauritius. These actions are centered on job support schemes, capital investment in infrastructure, the setting up of a sovereign fund to support the private sector and investment, as well as a relaxed monetary policy to maintain investments in the economy. I believe this is what leading economists of global institutions like the World Bank, the IMF, are advocating. But let us not forget that it is only on the firm foundations of sound and resilient public health that economic recovery can be built. In this respect, we are fully alert to the fact that climate change remains a major threat to public health. We are also aware that climate change is changing the way we must approach the protection of vulnerable populations. It is for this reason that under the Green Climate Fund, we are pursuing a proposal jointly with the WHO with a view to building a climate-resilient health system in Mauritius. The underlying objectives are to strengthen the resilience of the health system in Mauritius to climate vulnerability and climate change. We hope to develop in due course a climate change and health vulnerability and risk profile. This will enable us to identify options for adaptation solutions to reducing the health risks of climate change. The COVID-19 pandemic has laid bare the inequalities that exist amongst nations. This is nowhere more evident than in the area of having fair and equal access to safe, effective, and affordable COVID-19 vaccines. Such an access is key to change the course of the pandemic and help countries experiencing catastrophic economic and fiscal impacts move toward a resilient recovery. As we speak, some 150 coronavirus vaccines are in development across the world. And following the announcements made by 2 pharmaceutical companies this week, hopes are high to bring one to market in record time to ease the global crisis. We continue to call for global leadership and coordinated response to ensure that any approved vaccine is distributed equitably. We commend here the World Health Organization for coordinating global efforts in collaboration with Gavi to develop a vaccine to the COVID-19 Vaccines Global Access Facility. In Mauritius, despite our limited means, we have pre-ordered vaccines under the COVAX initiative for 20% of the population, focused on vulnerable and frontline staff. However, my real concern for 2021 is that of equity in rebuilding from this pandemic. My government will be supporting all initiatives aimed at ensuring that other countries, particularly across the African continent, are duly supported. Ladies and gentlemen, like in all countries, Mauritius will have to balance complete reopening of borders with an increased risk of imported cases. That is why quarantine, testing, contact tracing, and technology remain so important. At the end of WISH 2020, I would like to leave you with some positive news. Speaking to my education team, they report a growing interest from young people to continue their education, training, and careers in medicine and public health, as well as STEM subjects. This results from them seeing the difference that science and medicine make to people's lives. If one thing positive can come out from 2020, it is that adversity builds commitment and hope brings resilience. This is a war that we, and especially our youth, will not forget and will grow from. Your Highness, Excellencies, Lords, ladies and gentlemen, thank you for your kind attention.